Hello, I'm Dr. Dennis McKenna. I'm joined again today by Dr. Venditti, our hospital system general director. Today is day 25 of Incident Command, giving you the update from Albany Med on the coronavirus. Yesterday, we talked about the numbers in the region of people who had tested positive for COVID-19. We thought it was better to describe not what was just happening in Albany County, but in the surrounding counties. Yesterday, we described the number was just under 500. Today, there are 569 positive cases in the 5 surrounding counties. So that's about a 10% growth in cases from yesterday. That includes people who have been treated and have been discharged. It includes people who never came in the hospital, and it includes the people who are in the hospital. Let's talk about what's happening inside here at Albany Med. We know that here at Albany Med today, we have 44 patients in the hospital who have tested positive for COVID-19. We have 29 who are being cared for on our medical surgical floors, and we have 19 of those who are in our ICUs. And of those, 14 of those are on ventilators. Now, to put that in perspective, we have 448 people in the hospital today. Fred, you and I know that we often run this hospital with a census of 700 or even 750.
That's right.
So the census in the hospital is down, but about 10% of that population is populated by people who have COVID-19.
That's right.
Now, among those people who are in the hospital, among those 44, 14 of them are the patients who were transferred here 2 days ago. So what update can you give us?
So Dennis, you're right. 14 were transferred. 8 of them are on the regular medicine floor, and 6 of them are in our intensive care unit. They're all doing reasonably well given the fact that they have this illness. And I would emphasize that they're extraordinarily grateful that we took them into our facility.
Do we have any update on whether or not the medical center will be taking any more transfers?
So we didn't take any additional transfers yesterday, but this morning we received a call again from those 2 hospitals in Queens and asked if we would take some more patients up to the medical center. We've been talking with our colleagues in the community, and we've decided to do a regional approach to this, and so we'll be taking some additional patients today to the region, not just to Albany Medical Center.
And we think over the next couple of days we'll probably have some more information on that as well.
We will. This will probably be a day-by-day thing, as we talked about when we first informed everyone about the patients that came from New York City.
And as we talked about 2 days ago, if we take any transfers in, we will always balance that with what's happening here on this campus and our ability to continue to care for people in this region.
So you said the most important thing, Dennis. You talked about our current census. So we can care for easily 750 patients in this facility, and we're about 300 under that.
Okay.
So we have lots of capacity. I'm very confident that we can take a few patients from New York City and still have the ability to care for our region.
Okay, very good. The other topic we often talk about is PPE, and I know there's a lot of talk about the different types of masks, and one of the masks is an N95 mask, and so I think there's been some work on a subgroup that you commissioned to talk about those uses and who wears them and how they're going to be distributed.
That's right. It's a great group. They've been working very hard, and they've been working from 3 principles. They call it the 3 S's. It's safety, science, and supply. So they're applying those principles as they come up with ways for us to safely, based on science, use the PPE that we have. So they've developed a new approach to N95 masks, and I'm just going to look at my cards to make sure I get this right. So tomorrow, N95s will actually be loaded into Pyxis units on the floors, and those units that don't have the right kind of Pyxis units, they'll actually have locked boxes with the masks in them, and the key will be in the Pyxis on those units.
And Fred, for people who don't know, the Pyxis machines are where we normally store our medications, and as we control who gets access to them.
You have to swipe to get in, and then it actually logs that Dr. McKenna swiped to get into the Pyxis. There's a whole process. The primary nurse that is involved in the care of that patient will be involved in dispensing N95s to those people who aren't normally on those units, like physical therapists, etc. The code teams, the stat nurses, others that kind of move around from unit to unit. There's a special process for them. They'll be educated about that process. We're going to sort of use our huddle boards as a way of communicating this tomorrow, and perhaps even today, these posters will be on the huddle boards. I'm sure you can't read this, but it talks a little bit about when it's appropriate to use an N95, when it's not necessary, and when there's a requirement for a little discretion. So safety, science, and supply.
Okay. And the UV light piece is also part of this as well.
So again, we talked the other day about extended use. So we're continuing to do that extended use with the face shields and reuse of the N95s. So we've started the process with the UV light. I'm told that yesterday we actually reprocessed or disinfected 100 masks.
That's great.
I'm told we can do 100 an hour. So literally we can disinfect in a day reasonably 1,000 or more of these masks. So we're going to continue to do that, open that up to more areas where we use the N95 masks.
That's great.
Right
Okay.
now it's just in the operating room.
All right, wonderful. Do you
Yeah.
have any questions for me?
I do, Dennis. Why are we wearing these shirts today?
So we're wearing Emergent Care, which you know, Fred, because when Emergent Care came into the medical center, you were obviously the person who helped bring it in here. This is our brand of Urgent Care, which has been up and running now for many years. We have 13 different locations. And consistent with what we've been trying to do with televisits in the practice, I'm now proud to announce that starting early next week, we'll have the opportunity for people to do virtual visits, televisits with Emergent Care. And so there'll be some more information about that. If you go to the website for Emergent Care, the details on how to have those appointments will be there. More information there than I'll give here. But the good news is, if people want to be able to access those providers, they'll be able to do so remotely, which is great.
That's actually fantastic, and this will be something that'll be durable and will last beyond the COVID crisis.
That's exactly right. That's exactly right. The last information I have today is the Dean, Dr. Verdile, announced today that consistent with all the rules regarding social distancing, we're going to have to take graduation, which is an incredible day, not only for our medical school, but the others who graduate PA school and our medical ethicists and our scientists. We're not going to be able to have it the way we traditionally have it with everyone there. I know that the events around the graduation weekend will also have to be canceled, but the alumni office and the college is going to do something special for those graduates, and we're obviously sad to mention that news, but we understand why, and we support the dean's decision doing that.
Yes.
In addition to that, we would just like to say to the college, we know that you're continuing to work very hard educating our students. You're still doing your research. You're still doing all the missions that the college does. And although we spend a lot of time talking about the hospital and what's happening here, you know, we just give you a shout out too, because we know that you're still here and you're doing great work, and we appreciate that. So thank you. So that's it today. We, as always, thank you for joining us. We ask you to take care of yourself, we ask you to take care of each other, and we'll see you tomorrow.